Hello, everyone. I'm Katie Burke, and I am the Health Beat Leader on Environmental Health for AHCJ. And this webinar is one in a series of topic-specific training opportunities to brief health journalists on the latest information in a particular area and to give you story ideas or resources you can use in your work. Today's topic is about finding local climate health stories because people often struggle to connect a global problem to their own lives and communities. I'm going to start off today's webinar with a stat from a study published in the Lancet Planetary Health in November on global climate health news coverage. It's really staggering. So here's the quote from the press release. Despite well-documented links between climate change and health and the demonstrable efficacy of this framing for enhancing public engagement, only a tiny fraction of news coverage connects the two. Out of 22 million articles published over the past decade in India, China, and the United States, just 0.007%, that's 7 out of every 1,000 articles, focused on climate change as a public health issue. When coverage did occur, articles most often highlighted the health impacts of extreme weather, heat, poor air quality, and food insecurity. Reporting on vulnerable groups, potential solutions to the crisis, and views of health experts were much less frequent. I'm going to drop the link in the chat in just a moment so that you guys can look over those studies in the press release if you want to. But suffice it to say that news media are speaking generally, not adequately informing the public about the biggest health issue of our time. And I know, we're all inundated with information that we need to be covering, but this is something that everybody needs to be covering more. In 2026, as climate impacts accelerate alongside rising healthcare costs and widening these disparities, local climate health reporting is essential for making the health risks of climate change visible, accountable, and actionable. Joining us today will be Janae Barnes, the health and environment reporter at Capital B Gary. Janae, do you want to wave? Here she is. Kirti Gopal, reporter for Inside Climate News. Want to wave? And Matthew Tejada, the Senior Vice President of Environmental Health at the Natural Resources Defense Council. And my illustrious co-host, Joanne Kennan, a longtime health journalist and an assistant lecturer at the Johns Hopkins Bloomberg School of Public Health. Joanne has been a driving force behind organizing this webinar, so thank you, Joanne.
And let me just sort of say why I wanted Katie to do this. I mean, many of you know that I was actually the original topic leader, but most of my career has really spent covering health coverage and the healthcare system, and increasingly in the last few years, public health as well. But I began thinking about, like, you have the cliche about, you can say in your newsroom, you're all health reporters, whether you know it or not. I think we are now all climate reporters. And climate and health, as Katie just pointed out, is an undercovered story, and yet it's part of pretty much everything we do. Any part of your body, like touch it. I mean, not here on the camera, but like anything, it's heat, cold. I mean, the change in climate is hurting us in more ways that I think many of us realize, or that I realize. And when I started doing this, my first instinct is to start with national stories because I'm a national reporter, right? And then I realized, okay, with the current administration, it's all stopped. So I said, okay, I'm going to look for interesting state stories. And it turns out the states, including the blue ones, have been significantly limited on what they can do. Not zero, but they have a lot less room to work on this. So I began thinking about, like, what are the local stories? And that's sort of, if you Google, you won't find too many because I'm halfway through 6 of them at the moment. But that I think is sort of the panel that Kitty and I put together, is to really just like look 6 inches from your desk and you will find a local climate story.
Yes, hear, hear. So I'm going to introduce our guests. Each of our guests will start presenting. So our guests will present, and then we'll open up to Q&A, and they can answer your questions. So you can go ahead and start asking questions if you'd like at any time. Type them into the Q&A space. So don't put them in the chat. We won't see them, but type them into the Q&A space, and I will direct questions to our guests. And we'll go ahead and get started with Matthew Tejada, who will provide important background about this topic. So Matthew, go ahead and start us off.
And what we asked Matthew to do is like really talk about the tools that are in the hands of communities that I didn't know about until I met him about 2 months ago. So now you will know what I know.
Yeah, thanks. Thanks, Katie. Thanks, Joanne. Hey, everybody. Again, my name is Matthew Tejada. I'm in charge of environmental health here at the Natural Resources Defense Council in RDC. I've been here a little over 2 years. So I'm in charge of climate adaptation. We have another whole department on climate mitigation, but we're in charge of climate adaptation because we deal with air quality, water quality, toxics, just environmental health. And climate adaptation was put into my portfolio because climate adaptation is where climate actually starts impacting the health, the lives, the safety of individuals, of families, of communities. Prior to that, I spent almost 11 years at the Environmental Protection Agency. I was in charge of the Environmental Justice Program that now no longer exists. And prior to that, I actually came up doing this work on the front lines in Houston, Texas, where I ran a community-driven environmental justice organization that's still down there doing great work. It's called Air Alliance Houston. But one of the things that was really formative to my experience down in Houston, working on issues of environmental health, was that even though, from an intellectual perspective, from a scientific perspective, we knew the really incredibly acute, chronic impacts that were affecting individuals, families, and entire communities from sources of pollution, especially on the east side of Houston out towards the Gulf Coast, where you have so much of the downstream oil and gas manufacturing and storage and shipping. We knew what the health impacts were. When you actually started going out into communities, very few communities and the folks that lived in them had those health impacts, up on the top of their lists of things that they were concerned about. I can't remember if I shared this with you, Jan, but one of my earliest recollections when I was first doing this work in Houston, there was a father at a Catholic church who was really popular, and it was one of the biggest Catholic churches on the east side of Houston. A lot of people would go to it every weekend. And this individual was just a really, really important leader in a lot of the communities in Houston. And I went to him to see if I couldn't get, his help on getting his congregation and more folks in the community, talking about and working on issues of air quality and air pollution. And he said, no, like that issue probably would be somewhere around 15 on a list of 20 things that this community cares about. It's miles away from being in the top 5, right? Which were about feeding themselves, about work, about make sure their kids got to school, about getting healthcare access, the real up close concerns that people have in their lives. And so I took that, and it took a while to really kind of connect what potentially needed to happen to get more folks kind of connecting that, well, those issues of, work or where your kid goes to school or having access to healthcare, like there's a real huge environmental health component to that. But trying to get folks to actually understand that, connect it in a way in their lives where it connected to them and it actually connected their lives, was hard. So one of the things, though, that we found to be incredibly effective at not just getting folks to start seeing how these dots connect, but how they connect in a way that really mattered to them individually, personally, right? Inside of their homes, inside of their kids' schools, where they would go to play, soccer or whatever else on the weekend. A way to get them to start to connect that was by putting science in their hands, right? Really helping communities to take control of using ever more effective and ever more cheap sensors and monitors where they can actually start for themselves to understand, here's where the air pollution, here's what it looks like right where I'm at. Here's what it looks like at my kid's school. And my first experiences at doing that in the Houston area, where we had bought a few kind of portable particulate matter monitors, right? Another one of those pollutants has huge impacts on public health, will continue to increase in severity and impact as the climate changes, right? We're already losing decades of progress on particulate matter pollution reduction just from wildfires, right? And understanding how health impactful those wildfires are. But we bought a few particulate matter monitors, and we would go with, we'd show up early in the morning in some of these neighborhoods to walk with moms, as they left their home to walk their kid the few blocks to school. And of course, as they walked the few blocks to school, they were going right past one of the main gates for the port, where all the trucks were starting up in the morning, and they were coming in and out of that gate. And those moms could sit there or stand there, walk there as we walked, and they could look at this little monitor, and they could see with every step away from the house, right, that monitor started to trend upward. And every time a truck went by, it would spike, and it'd spike, and it'd keep climbing, and it'd spike, and it'd keep climbing. And they could start to connect, wow, right here, every step I take with my child, right, more pollution we're being exposed to more pollution. And then they could start to connect, wow, I have to travel, like I'm thinking of a particular community in my head called Galena Park on the east side of Houston. Folks in that area at the time had to take 2 buses, and it would take hours to get to a federally qualified health facility that was either on the other side of the ship channel, or they'd go way out to the Beltway to access the county hospital for health services. There was no other health services anywhere around Galena Park except at the elementary school in the middle of Galena Park. There was an asthma care center for the students. And they started to connect, like, oh, wow, we have an asthma center for the kids in our neighborhood because those kids are being absolutely inundated with this thing that I can now hold in my hand and see it happen as I'm walking my child to school. And that just opened up so much opportunity for those folks to understand the connectivity between their lack of access to healthcare, but this acute facility they have, between what they would smell, what they would see when they'd wake up in the morning and they'd run their hand on their car and they'd wipe away, all sorts of dust that wasn't natural in color, the smells that they would get, and then the impacts on their children. All of these things started to connect, right? And this issue that was maybe 15th on a list of 20 things suddenly became related to like 3 of the top 5. Right. And they would get outraged. They'd really start to question, well, why is this happening to us? Right. So you could start to also bring in, well, it's happening to here for longstanding, environmental racism issues, for how investments have been made over time, for why you live here because housing is super cheap and it's not being protected, why there's not a monitor doing this necessarily in your community, or why that monitor is not being responded to. All of these things started to just light up in a way that very much personalized it, and didn't just personalize it, but supporting community science for individuals to actually hold it in their hand and start to feel like, no, I have agency here, right? Like, if I can do this, what else can I do? Opened up conversations about organizing, right? About seeking political change in their neighborhood, about, putting in their own monitoring network. Fine, if the city or the state's not going to do it, can we do it? Yeah, we can do it. Let's buy a few more of these. Let's put it at your house. And, do you know somebody else? We can put it at their house. Do you know one of the teachers at school? Maybe we can put it at the school, right? It just opened the doors to that. And especially at this time, right, where individuals are starting to now feel climate change in their lives, right? It's starting to impact people in very personal ways that we haven't necessarily in such a broad way experienced. And the need to really start connecting policy conversations, big financial and budgeting conversations, international, like all of this heady stuff that for so long has been impenetrable to so many of us. I think there's a real opportunity just sitting there for us to look at our experience just traditionally with trying to get folks to understand and embrace environmental health, and now connect that over to getting folks through environmental health and through looking at science and empowering folks, right? Keying in on their ability to take agency through science to connect health and what's happening in their lives to these very heady, abstract things like, the Paris Climate Accords and what's happening at COP every year and all these other things, right, that are really pretty meaningless otherwise to most people. There's an opportunity there for us to start to tell that story, but to do it in a way that's really grounded and centered on impacted communities, their lived experience, and their ability to really be the ones telling them, this is what's happening right here in my neighborhood, and I can show it, right, scientifically. It's not just
I
me.
love that.
I'm going to stop.
I love that way of grounding it.
End.
Yeah, I'm gonna have to. We need to move on to Janae and
Sure.
Kirti. But I love that you're giving it a concrete way for people to relate to these issues, because that's so often one of the hard things about communicating about a global issue. Um, I'm going to turn things over to Kirti next. If you have questions for Matthew, then you can go ahead and drop them in the Q&A section. And then Kirti, uh, would you like to go ahead and talk about how you think about this issue?
Also, Kitty, I'd be curious if you've covered communities that do have these monitors. I mean, we'll come back to Matthew and ask more about how does a reporter find out where they are, but if you cover both local and national stories, but I'd be curious if, if you've written about the story of what happens when a community gets these tools.
Yes, absolutely. Thank you for having me, and thank you for highlighting this really important intersection. I work at Inside Climate News, so we're a newsroom that's fully focused on climate change, and I think we talk a lot about the challenges with, communicating about this really big global issue. And I really do think that health is one of the most clear and intimate ways that we can, as reporters, like make it really, really clear how these big issues impact your health, and impact individuals and residents and communities on a day-to-day basis. So yes, I can talk a little bit about, I have covered some community air monitoring projects, and I think that's a really, really fantastic route for reporters to go, because there are a lot of like local air monitoring projects. I think Janae is going to talk about this a little bit too, but
I didn't mean to restrict you to this. I mean, you have other things, you've done lots of other stuff, but I was just a little
curious. Yeah. No, I'll talk about both.
Matthew was talking about, and then tell us about other cool stuff you've done. Right.
Yes. Yeah, but I will say, like, I was reporting a few years ago in New York City when I was based there, and I was reporting on a study that some researchers from Columbia and Fordham were doing with high schools in the Bronx, and they were actually putting air monitors inside and outside of schools to check the kind of differences between indoor and outdoor air quality. And they were also giving students these portable air quality monitors, similar to what Matthew was talking about, where they could actually like check kind of what the air was looking like on their commute to and from school. And I thought that was a really cool project. And I know that there are other community-based projects like that all across the country. In this case, they were using Purple Air monitors, which is a really great resource. You can look at Purple Air online and see like where monitors are placed in your community. They have maps, and it's a really, really easy way for you to just see like where people are actually doing this kind of citizen air quality monitoring. But this was a really cool project because you could see these high school students kind of looking at the data that they were collecting on their route to and from school. And it happened to be that I was at one of these schools on one of the days that the sky turned orange because of the Canadian wildfires in New York. So it was like a really, really poignant example of how climate change impacts health on a personal level. And I was talking to kids with asthma who were saying, I felt worse today. And then I got to see on my air monitor why I felt worse. So that was something that was really cool to get to cover, and is for sure accessible to a lot of reporters wherever you are. But I also wanted to talk a little bit about in this kind of moment of like, there's pullbacks on the national level from a lot of climate programming, like what can we be looking at on a local level, both on how those national policies are impacting our local communities, and also how local communities might be filling in the gaps or not filling in the gaps. And then also to echo what Matthew was saying, really focusing on how can we be providing information within that context that is actually really actionable for people in their lives and is really useful for people in their lives. So I wanted to talk briefly about a project that I was working on last year around a lead pipe replacement in Chicago. Chicago has the most lead service lines of any city in the nation, and those are like the water pipes that bring water from the water main to people's homes. And it's federally mandated that all cities have to replace all these lead pipes. But there's been kind of some uncertainty and confusion with funding for this project, for this mandate, and also like what maybe is going to happen with parts of the mandate under Trump's EPA. So last year, or actually in 2024, all water systems had to submit an inventory of all their lead service lines. And when I was speaking with community members in Chicago about kind of what environmental issues were top of their mind, something that was coming up a lot was water quality, and people kind of knew about, some people knew about the lead pipes, but people didn't necessarily know where they were, or how to find out where they were, or how they were impacting some communities more than others. I actually was speaking with one of Matthew's colleagues here, Gina Ramirez from NRDC, who is a lifelong resident of the Southeast Side, which is a neighborhood in Chicago that has been overly burdened by pollution and industrial environmental injustices. And she was saying, I feel like there's more lead pipes in my neighborhood than other neighborhoods, but I don't know if that's the case. And so that kind of kicked off this project for us, where we decided to actually map all the lead service lines in the city. And we like FOIA'd for the inventory data, which is all water systems had to submit them. So it's very likely that your water system might have that inventory available. And we basically like mapped all those pipes onto the city and created this interactive tool where people can look up their address and see what the material of their service line is. And they could also see what the distribution of lines is like in their neighborhood, how that compares with race and income, and also access resources for like how to get a free water test kit, or how to potentially get your line replaced if you do have a lead service line. And that was a project that we initially were just really thinking of on the local level. Like we were just looking at it in terms of, okay, this is a problem in Chicago. Let's see how we can get people information about Chicago. But it ended up turning into quite a few stories that had a lot of both local and national significance, because of how much the kind of uncertainty around federal funding is impacting cities' ability to address the problem. And so that's sorry, go ahead.
I have a question just to interject. Is that I'm not sure that people will immediately see how climate and lead intersect. So can you just like bring that in?
Yeah, that's a great point. Yeah, so it is an environmental issue, but I think we're increasingly seeing how many environmental issues are impacted by climate change, and how, we have to be thinking about these things more holistically. So there is evidence that rising temperatures and climate change are actually making the amount of lead that kind of comes into your water through pipes higher. So there's some evidence that it could be increasing the threat of lead pipes to people's health. Because the thing about lead pipes is, just because you have a lead pipe, it doesn't necessarily mean there's a high quantity of lead in your water, but there's many factors that can impact when lead kind of gets dissolved into a person's drinking water, and there's no safe level of lead in your water. So if you have a lead pipe, that is a hazard, and climate change is something that researchers are saying could be adding to that hazard. So it's absolutely an intersection. I think we think about that a lot too, like how can we be making those articulations more clearly for people?
Hey, let's thank you so much, Kirti. That's super interesting, and I love how you're bringing things in again to that community personal level that people really connect with. Let's turn to Janae next. And Janae works at a local journalism publication, and so she can talk about what that's like and how she looks for these stories.
We
Janae.
have a local one wrapped inside a national one, so you can
Yes.
right.
Yes. Hi. Hello. My name is Janae Barnes. I am a health and environment reporter with Capital B in Gary, Indiana. If you are familiar with Gary or like the Midwest, Gary is like maybe like 45 minutes outside of like the Chicago area. And it is nestled between a number of industrial entities, namely U.S. Steel, which is one of, I think, the largest integrated steel mill in the country, as well as next nearby Buffington Harbor and Cleveland Cliffs. So these are industries that create like coke and steel for the area. Gary is also a predominantly Black community. It has, namely, it's the home of the Jackson family. That's like their claim to fame, but they also have had a number of contributions to Black history. It had one of the first Black mayors of like a major city, of Mayor Hatcher, and is now continuing to kind of pulled itself out of years worth of like industrial like pollution. So over the 2 and some change years I've been with Capital B Gary, which is a new local newsroom in the area, I've been able to kind of carve out what a health and environment beat looks like for the region, which hasn't really been covered in this area like that, specifically in the Gary area. We do get some coverage from local Chicago, shout out to Cutie, but just kind of more embedded in the city as well. So a lot of my stories cover health equity and environmental justice issues. Namely, we touch on a lot of air pollution. As Matthew and Kirti were saying, air quality is a big issue for the region because of the Gary Works steel mill, as well as we touch on lead service lines. I think the area that Gary is in accounted for about 2/3 of the lead service lines in the region of Northwest Indiana, as well as environmental deficits like historical redlining, which lead to, again, more higher lead exposures, as well as soil pollution as well. So that's just kind of a broad spectrum of the things that keep me busy on my 9 to 5. But a lot of what I cover, people always ask, do you cover like health or environment? And I'm like, I cover both and how they connect, right? And those are two, they're related, but they're very much not the same. And I think the best way I can kind of exemplify that is there was a woman that I got to interview. Her name was Dr. Beverly Lewis, and she is a doctor now, but based in Gary, growing up in Gary, she had a number of health issues, and her family had a number of health issues. Her brother unfortunately passed due to asthma. Her father, her late father, also passed, was a former steel worker in East Chicago, and she recounted, him coming home being covered in coke stained smudges, black smudges, and coughing up black phlegm. And even herself, she worked at the steel mill to pay her way to get to college. And she remembers saying how she couldn't get the black smudge out of her clothes like for like the entire summer, right? And eventually, growing up, she was like, I feel like this is because of the air. But it wasn't until most recently, to last year, there was a study done by Industrious Labs, who is, I would say, a great resource if you're unaware of them. They put together a lot of great data about industry and the environmental and health impacts of them. And it found that, to no one's surprise, that the steel mill industry was a huge contributor to the health issues in Gary in the Northwest Indiana area. Just so I can kind of illustrate that a little bit, they found that U.S. Steel alone is accountable for over 114 premature deaths, 6,000 work loss days, 31,000 asthma symptoms in their area, and about 50 ER visits for respiratory issues a year. So this has been a huge issue for people in Gary, and people from mothers to doctors to local politicians have all said that they've struggled with respiratory issues, with asthma, and it's even been reflected in some of the ways that they try to advocate for their health. For example, I interviewed some farmers last year who one used raised beds for their plants because using the soil is not usable for planting in agriculture. So they use raised beds and they plant things like mullein leaf, which is supposed to be like a natural respiratory aid to help with any kind of like coughing and respiratory issues because it's just that frequent. So it's a community farm. People are able to plant and take as they need. But it just shows that like how prevalent it is for residents in the area. So over the last 2 years, I've just been able to get that exposure and I think help validate the residents who are there with the data that they've said. Like we already have the qualitative data, but now we have the quantitative data to back it up and hold these entities accountable for the health and environment issues that they have been experiencing for generations now.
Wow, that is so evocative, and these personal stories really bring home how important covering these issues are. And when you start digging, it's there. Um,
I had one.
okay, so I'm gonna.
Can I have
Oh, Joanne has.
a quick question
Yeah.
before we go to the Q&A? When I interviewed someone for one of the stories that did get finished and published, I interviewed someone and this came up as an aside, and I haven't gone back to it, but I'm sort of curious of what all of you know, and maybe we've corrected it because the research I'm about to describe is a few years ago, and maybe we've gotten better. But I think he was actually a geographer. He had mapped. I think he was in Indiana at the time, and he had mapped where cooling. He had mapped where cooling centers were both in Indianapolis, and the suburbs. And he found that in the city, the temperatures were about 20 degrees higher than the leafier, less developed suburbs, but the cooling centers were predominantly in the suburbs where the people in the city many didn't have cars, they were poor, you know the story. So I'm if this is saying widespread that reporters on here, I'm being told you can't hear me. Let me try to make it. It's pretty high. It's really high. It's very high. I'm not sure what's wrong. I'll just shout. Those kind of disparities between the cooling centers, which also tend to be 9 to 5 Monday through Friday, which is also not good. Are they this is an environmental justice issue? Have we solved this? Have people become aware we didn't put them up? Good intentions, bad planning. We didn't put them where we needed them because, all right, we're about to get, this monster storm and we're all going to be dreaming of sun instead of ice. But when the sun comes, we're going to be dreaming of ice again. So is this a local story that, like, where are the centers? Are they open and are they accessible to people who need them the most? How out of whack is it still? I don't know if any or all of you want to say that, because so much of it does come down. It's not only heat, but a lot of it is heat.
Yeah, I can just add that our newsroom, we do put out service stories letting people know where the cooling centers are in the area and the hours that they're open. Whenever we see that there's any extreme weather event, same thing if it's, very cold, we also put out service stories about warming centers as well. And we've been seeing more extremes on both ends. So when we covered heat, we had a story about how to brace for the heat wave. It's like there was like triple digit temperatures for the region, and that would often just include me calling the Chicago National Weather Service and telling me, okay, how bad is it going to be? What do we need to know? So we definitely make sure to put out service stories to let people know the hours and the locations of cooling and warming centers when we know that there's going to be some extreme weather coming. But I'd say as Gary is a place that is majority Black area, there are more cooling centers in the more affluent areas of Gary. So they're not exactly evenly dispersed, even within, a majority Black community.
So people who are less likely to need them because can probably afford air conditioning are the ones who are going to have better access.
Yeah, and it's kind of a double whammy too, because then even those that can afford it are also in areas where they get higher charges for the utility bills, which is a whole other part of this problem. But either way, even if you don't have to go to a warming center or cooling center, if you're staying at home, then it's going to come out of your pocket in another way. So that's just it's been something that's very multifaceted.
Yeah, I just want to add also, this is a really important thing to be focusing on. And you're mentioning like the disparity between the city and the suburbs. And there's also even disparities within the cities. Like a few years ago, there was a study in Chicago that found, I think it was like a 22-degree difference between two different neighborhoods in the city in terms of like the high heat temperature on hot days. So, we know about the urban heat island effect, but we know that different parts of the same city are being impacted very differently by these temperatures. And then, like Janae said, there's also very large disparities in terms of like people's interventions and what they have. And Chicago also has like these distributed cooling centers. And last summer during one of our heat waves, I went to a few of them just to see how they were being used and what was going on. And I think that's like just a great place to start for a story if people are in a place where there are some resources like that available, because I found that that most of the cooling centers were completely empty, even on this very, very hot day. And then there was one cooling center that did have people there, and it was mostly unhoused people who were using the center, but they had to leave at 5. And then a lot of them didn't have a place to stay that night. And so you can see kind of like the limitations of even these resources that do exist. Like who are they serving? Who are they not serving? And I think that's a really rich area to report on, and yeah, probably is applicable to many of our cities.
Yeah, and I think just to add, I mean, everything that both Janae and Kirti said, and Joanne, I think it's a great example of just how hard baked inequities are into the system and structure of our society. Right. And there's lots of these sorts of examples. And Kirti, kind of to lift over you're saying, like, you can take any of these examples, and if you just scratch a little bit, you get 100-year-long story starts to unfold going back, looking at where do people live and why, housing, transportation, school placement, and that rolls forward to the decisions that get made today. Even when, even for a lot of those folks, and coming from, being in the federal government during the Biden administration, when we had things like Justice 40 that were really forcing a lot of people at the federal, state, and local level to question how they made decisions, what sort of considerations, what math did they use to allocate resources for drinking water or for wastewater or for things like cooling centers or climate adaptation measures. So many of those folks, from my personal experience, they weren't out there trying to do things, because they wanted, they had some sort of racist agenda or a classist agenda, but they were functionaries in a system that was hugely inequitable. And they just kept kind of, pushing that system forward. And until you interrupted that and said, no, 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 look out there and look at the impact, right? Look at where there's a need and look at where resources are actually flowing. Until you actually connected folks with the reality on the ground, it was really hard to get people who actually made those decisions to really question why and how they made those decisions, and to really think about, where are the areas of greatest need? Why does that need exist? And what can you do about it today? And it's a really important function for journalists to keep, opening folks' eyes to that story.
This is great, guys, and I'm gonna go ahead and move more formally into the Q&A, which I think is sort of, we've segued into, but I want to make sure people get to ask their questions. So make sure to put your questions in the Q&A section, and I'll go ahead and kick things off. So my question to you guys, and you can go in whatever order you want. What are some reasons health journalists may not have covered climate issues very much, and how how can we overcome those barriers? What are some ways that you see that we can overcome those barriers?
I can start. I think coming from an environmental reporting background and then transitioning into environment and health, they're treated as two separate beats. And so they're not always encouraged to be in like intersectional. Um, and I'd say that because that is treated like two separate things, we're not seeing enough reporting or coverage that highlight how they do interact and how they do depend on each other. I'd say a way we can kind of come over and try to avoid that. Um, I always go into stories now like, how is this a health story? How is this a climate story? Because really any story can be a climate and health story. If you're looking at it broadly enough, you can find these intersections. One way that helped me, I actually completed a science, health, and environment reporting fellowship, which was co-organized by AHCJ. I would recommend any early mid-career journalists to check out that resource. It's a fellowship, a year-long fellowship that encourages and teaches reporters how to find these intersections and how to report on them to your audiences. So that
That's
helped me
the
a lot.
SURF Fellowship? Is that the one you're talking about?
Yes,
Okay.
the Sure Fellowship, yes. And I would say if, say, your editor is coming to you and they're like, hey, I want to show how this is a health story. One thing that's always helped me is to you find resources in like the unlikeliest places. So if you're going into a health story, but you want to find like a climate angle to it, check out some climate reporting on it because 9 times out of 10, that's going to give you the nugget that you need to connect that link. And sometimes it's more obvious, sometimes it's not. But the more you read up on both, the more you're able to see the connections between the two.
I just want to add, and I totally agree with all of that. I think that something that could be really tricky about climate and health is that as reporters, you're sometimes looking for like a causal connection between things, or you want to be able to say like this caused this, and this is what this caused this harm. There's this, you know, that's like a narrative structure that we're used to. But with climate change and health, these are very complicated issues, and somebody's health is impacted by so many things. And it's not going to be as clear cut necessarily as like the pollution from this industrial facility we can definitely say caused this health harm in this individual person, right? Like there's a lot of factors that go into that. And I think we also have to be really careful about like what we're drawing in terms of links. And just as an example, like I was doing some reporting on worker heat deaths in Texas. And that's an area where there's, heat deaths are severely undercounted because it's so complicated to understand like what goes into some of these deaths, and it's not always clear cut that it's like a heat stroke and then the person dies. But that doesn't mean that heat didn't impact the conditions that led to their death. And that's something that researchers are kind of pushing for. We need to do a better job of incorporating and naming heat as a factor. But when you're actually doing the reporting on it, that can be really tricky because you're looking at an autopsy and it says an undetermined cause of death. And you're saying, okay, well, this person was working in 105-degree heat and they had no water breaks, and they collapsed and they're 18 years old, and it seems like heat played a factor, but you can't like necessarily definitively say that heat was a cause of death. So I think some things like that can make it really tricky to draw these connections on this like hyper local, hyper individual scale. And I think in that story, we did end up writing about these heat deaths, and these were deaths that were being investigated by OSHA, and OSHA had found that they did classify these deaths as related to heat. And so that's one resource, is you can look at like, what are the agencies that are investigating these deaths? You can talk to experts about like, we showed the experts these autopsies and said, okay, what would you look for here? Like, what do you think could be a factor? And then just be really real with your readers about what we don't know and what maybe there needs to be more research on. I just think that's something that can get people kind of nervous to write about these connections sometimes because they're like, well, I don't know exactly what this connection is. But that's, I think, why it's so important for us to be making those connections, asking those questions out loud, naming the lack of data, saying this is undercounted and we need to understand this better, and then writing about what we do know and what we can say definitively.
Yeah, I would just to plus one to what Kirti just said, not to repeat it. And I think that's such a valuable service to those of us in advocacy, is to have, colleagues in journalism pointing out where there's a gap, where there's a hole, where there's a need, right? Not necessarily needing to explain everything, but just saying like, this is looks like a huge issue, and we are not addressing it nearly aggressively enough. Like, just that sort of truth, that's its own sort of truth, but it is truth. But that sort of truth is so important for folks in the advocacy world to be able to say, but this is being reported on, state lawmaker or public health official or whoever, right? To really get folks to focus in on these big gaps of knowledge that we need to fill.
Also, could I just, sorry, I just wanted to touch on that because it's a really great point that you both made. And to Kirti's point, one thing that helped a lot for me, because it is hard to draw causality, direct causality, but looking at amplifiers and seeing how like there's like climate amplifiers, risk amplifiers to certain events, that always helps. And then also looking at excess deaths, particularly when it comes to heat. You can see a lot of studies done, which is like the fallout of the event. So sometimes there's deaths and then there's excess deaths, which is kind of like the aftermath of a usually a heat related issue. So those are just my two tips there.
Do you want to define, I mean, I think most people listening understand the difference between excess and regular deaths, but do you want to quickly define? I mean, we all, I think we're all exposed to it during COVID too. But.
Yeah, pretty much. Yeah, I think that's if you're just kind of looking for information, you're looking for data, those are like keywords that I think that would be good to know and to search when you're trying to connect these dots between these two different worlds.
Because it tends to be that the deaths is sort of what one would expect in a certain time frame and place, and the excess deaths is if it's way higher than normal, what are the factors that caused it? And in this case, it could be a climate heat or something related. Yeah, I mean, again, when you don't know, like Kirti was saying, when you can't really, if the medical examiner won't say it, it's hard for us to say it. But these are sort of larger data sets that you can get someone to say why the deaths were excessive.
Yeah, just to add to that, like it's the difference between saying like, here are the heat deaths during this heat wave versus saying like, here's how many people die on an average week, and then here's how many people died during this heat wave. And that's like it's not always done. Like agencies and cities aren't necessarily always naming things that way or counting excess deaths. But Janae's absolutely right that like that's really crucial. Researchers are really pushing for that. And if you can find that information, that's a really great way to help your readers understand.
Oh, that's such a great nerdy tip there. I feel like, being able to dig into the data is so important. And I will also say a challenge I have come across, and I bet others have too, is sometimes if I'm doing something in this intersection, then an editor will either make it more of an environmental story or more of a health story because those are like silos that they have in their heads. And often they have good reasons. Like maybe there's that's how they categorize things in their publication, or or the story needs some streamlining, and this is an easy way to do it. But I think that there really needs to be some thinking even at the editorial level about how to create spaces for these intersections. And so we have a couple of questions. We have a quick one, so I'm going to do the quick one first, and then we'll get to the longer one. So Marina, I hope I'm saying your name right. It's Marina or Marina, I'm not sure which. Kirti, she says, Kirti, what did you mean about amplifiers?
I think Janae was actually talking about amplifiers, right?
Sorry, yeah.
Janae, okay.
Sorry. No, it's a great question. So, when I meant by amplifiers, I meant climate risk amplifiers. So, oftentimes, any major climate events like floods, heat waves, droughts, etc., um, these are contributors that can exacerbate or worsen the event itself. Um, the best way I can kind of describe it is, for example, like in Gary, we have, of course, a lot of air pollution, and that only gets worsened by the increasing temperatures that we're seeing, right? Because when you have polluted air and then you add a lot of heat to it, it makes everything worse. So there are different factors, climate factors that can worsen these kinds of vulnerabilities that people have. And then if you get into like the socioeconomics of it, again, like Matthew was saying, where people can live, where they can move, things like that. There's a lot of like social and economic contributors as well. But that's pretty much the idea of amplifiers is that there are different ways to contribute to different contributors to one event, which is why, again, it's so hard to directly link that this, climate event directly caused this like health impact. But looking at amplifiers can help clear that picture a bit more.
Okay. She says, thanks. That makes sense. And Susanna, I also see that you have a question. I can't tell whether it's really a question or a comment, but if you can streamline it into something shorter, then I will read it out. But I'm not quite sure how to incorporate your comment into the larger conversation. Okay, so I'm going to ask a couple more questions. We've got to wrap up pretty soon. Let's maybe like personalize this a little bit more. We've asked sort of why journalists in general struggle to cover this topic, but maybe you can talk about some challenges you have encountered in working on a story and how you have worked through that, so that we can kind of ground this into some personal boots on the ground journalism.
It's what I called when we were talking before the actual webinar. I said, tell us about when you hit a brick wall. And did you get around the brick wall, under the brick wall, over the brick wall, or did the bricks fall on you? And all of them have happened to me. So, how did you solve a problem or fail to solve a problem? Either one of you want to start. Janae, you start. A story that you thought you were going to do. You're on this path and you thought you were going to get here and kaboom, you got stuck. Did you on a climate story, did you get around it? And how? I always think of like the magic brick, and when I was reading my kids the Harry Potter books, right? Like the brick that opened up the alley. Where was your brick? Did you find it?
Yeah, I was just thinking about this because like I've had a couple.
I think like you're really good at what you do, and I think it's good to people who are just starting to cover climate to understand that it happens, and it happens to people who are really good and don't feel bad about it. Just
Absolutely. Well, okay, so I was trying to get data from a health department about like maternal health for a maternal health project I did last year. And the reason why it's a climate story is because I was trying to gather information about any climate contributors to these health issues. So when I showed up to the health department and they were having like a closed session. So I waited like 5 hours to get until they ended so I could go into their open session and speak with them and ask them my questions. And then when I got the data, which is one hurdle of itself, I realized that a lot of the information in the report that they had given me did not include climate like contributors. So I got to basically call a environmental health expert, and I use Sciline. I will always shout out Sciline because they're amazing, a great resource. Check them out. I asked them about the top health issues that were identified in the health report. I ask a environmental health expert about these issues to contextualize what environmental contributors tend to lean into those health effects, if that makes sense. So my wall was one, getting the data itself because I had to wait 5 hours, and two, contextualizing it in like for like a climate story, right? Because the health agency itself didn't consider environmental parts into that report. But yeah, but sometimes you have to call the right person, get the right context. If you're looking at an environmental health story, go to environmental health experts because sometimes they're the ones that can better define that connecting line.
Nice. Okay. I would love to hear answers to the question from Kirti and Matthew, but I also want to ask, Susanna did submit a shorter question, and I think it's a really good one. So she says, what do you recommend for freelance journalists covering indoor air quality who don't have access to a lot of the fancy air monitoring resources?
I can take this unless others have an idea. I've actually never done a story where I specifically like got an air monitor or anything like that. Like I'm usually not doing my own air monitoring for my reporting. I'm working with air monitoring that's happening already. So there's definitely resource, and it's cool if you can do your own monitoring for sure. But there's a lot of people who are doing that you can work off of. So Purple Air, which we mentioned, is a really good resource because you can find if there are people in your community that you're trying to report on who are doing air monitoring, look on Purple Air, see where those monitors are and reach out to those people and see like what they're doing it for. Is this a personal project? Is it a research project? Is it a community project? Like why did they get those monitors? What are they looking at? And then you can use that data. Also, I would say reaching out to like local researchers, universities is a great option. There's a lot of researchers who are looking at air quality, and if like they're in your city, chances are they're looking at that in some capacity. There are EPA run air monitors as well, so you can look at the EPA data. The only issue is that it's not as hyper local always as sometimes you might want to be looking at. The American Lung Association does a great annual report on air pollution that is a really, really great resource. So you can look at, your state and your city and or counties. I think they do it by county a lot of the time. So you can really kind of use that to as a jumping off point. So yeah, I think that's what I would say. I would say like local community organizations, local universities and researchers, Purple Air, ALA, Matthew and Janae, if I'm missing anything, please jump in.
Call Matthew.
Yeah, the only thing I'd share, I mean, to both Janae and Kirti's points, like it always surprises me when I engage with journalists and at the end they effusively thank me for spending the time. And I'm like, it's my job. Like you were doing me a favor by asking me for information. So if I can help, and that's like advocates, community leaders, academics, like please do follow that advice because they want journalists to contact we want journalists to contact us about what we're doing, what we know, what is the best data and science that can be used. If you need explanations for it, like we know who are the best scientists that can actually speak human to people and let you understand stuff that most of us can't. So we are a huge resource to be, hopefully that brick, the secret brick. I didn't read the Harry Potter books, but yeah.
You're missing something, right? And also like don't be afraid to ask a dumb question. Like that's part of our job. I'm like been doing this a long time, and I'll say to a source, this is a new. I'm an experienced journalist. This is a new topic to me, and I don't understand this. So help me understand. I mean, I'm not embarrassed. I've talked to lots of topics I didn't know about. And sometimes I sort of keep track of, who did I ask my last dumb question to? I can't bother them too many times in 1 week, but it's our job too to know what we don't know and to not be embarrassed about learning it. And I would also say several people, both the questions and the panelists, have talked about the silos between environment and health and how you're pulled between them. I think that one place that those silos are closing is in schools of public health that have environmental health departments or they call it different things, where you find people who are living in this space that's bringing together the climate and the health in a traditional way.
We've got to wrap things up. just before everybody goes, thanks everybody. Thank you so much, panelists. And if people want to follow your work, where can they find you? Can you drop it, or just say it, uh, or give it to someone to drop in the chat?
Yeah, my name is Janae Barnes. If you look up capital B Gary, that's where my stuff lives.
Yeah, I'm Inside Climate News, Kirti Gopal. You can find all my stuff on Inside Climate News. I'm also on like Instagram, X, Blue Sky, all of that. So feel free to hit me up wherever.
And I'm easy to find too. I think there is now another Matthew Tejada in the United States, and he seems like a very promising young man somewhere in New Jersey. But otherwise, it's just me.
Great. Thank you, everyone. And it's a huge area, so I hope you guys will not hesitate to reach out if you need more resources or have more questions. Thanks.
Thank you.